Expandable cages, weapons of mass delusion in spine surgery. Okay, guys, if you are a reasonable human being, a reasonable surgeon, you will agree, after I'm done talking, that expandable cages are causing delusional behavior in spine surgery, okay? So here's the thing. What are your goals of spine surgery? Decompression, stabilization, bony fusion, and alignment, right? Those are our goals. And if we go forward, bony fusion requires surface area of bone and the material properties of the implant either to make bone grow or not piss off the bone so it doesn't not grow, right? The other thing also is alignment really is related to surgical technique and using mechanical leverage to get there, right? And they're two separate things that we address separately. So there's a quest for optimal fusion and there's a quest for optimal alignment. But these are two separate goals that we're trying to achieve while we're doing an operation. What I would argue about expandable cages is here's the problem. They overpromise and underdeliver. They have limited bone fusion area. They have limited effectiveness. They have limited material properties, limited clinical experience, and limited cost justification. So I'm just going to show you a picture of an A-lift cage, a T-lift cage, and a lateral cage that is static versus expandable, okay? Which one of these has better bony fusion area? I mean, I don't even think I need to make an argument here. I'm just going to go on because it's clear that if you want a bone to fuse, you're not going to be using one of these like contraptions up here. I mean, these look like medieval torture devices, right? Limited effectiveness. Here's the thing. I use an expandable cage when I'm doing a thoracic corpectomy or cervical corpectomy. That's perfectly fine. But I'll tell you what, when you're doing those operations, do you know when it's expanded enough? Study after study has shown that when we feel it's tight, we have no clue how tight it is. These devices are so strong, they will piston or rip right through the end plates. Here's a study conclusion I just highlighted. Despite greater surface area contact, expandable cages have a trend for higher subsidence rate when compared with fixed cages. And it turns out when there's edge loading in the hyperlordotic scenario, there's a higher risk of subsidence and intraoperative fractures during the deployment of the cages. I mean, you may have difficulties putting in a cage, but expandable cages have their own issues as well, too. And you go in there and you jack up the end plates, you think you're doing a good job, but I mean, think about your lateral cage experience. You put in a lateral cage, you do indirect decompression, but how many times do you have a collapsed space and you put in another cage? If you expand that, you're just cracking the end plates. Because I've had subsidence with overstuffing a regular cage, a static cage as well, too. Material properties are super exciting right now. I call it Cage Rage 2.0. Right now, we've got these new cages that are biologically active. They're made of metal. Bone is attracted in there. We're able to make structures that mimic bone porosity and allow bone to grow. And this is a really exciting time right now if you're looking at new cage designs. Expandable cages cannot do that. You can take an expandable cage design that's really sort of like exciting and has all these features on it, but you're not going to be able to incorporate these material properties well. That's the thing. So as a result, you're essentially putting in either a block of metal or a block of PEEK, neither of which allow bones to fuse well compared with the new things that are coming down the pipe. I did a search on FDA Food and Drug Administration for recalls for spine devices. And on the first page, there were 12, 6 of which were expandable devices. You guys might have heard of this, the AccuLift devices there, and there's some other ones. There's actually 4 manufacturers here. The number one device that has an FDA recalls in the last couple years have been expandable cages. And I have seen these cages like, I had a patient who came to see me and an AccuLift put in, and the entire device is expanded into the vertebral body, I have had these cages expand and actually back out and fall out. They're not immune to the problems that you don't have, because what we're trying to do with the cages is restore some sort of stability while the bones fuse. If the bones fuse, it doesn't matter what you put in that space. And here's ultimately as well too. Let's say the cages are good. Let's say they do help. Can you justify a 10x? Are they 10 times better? I mean, you all talk about cost and cost conservation. A cage for a T-lift is so cheap. I mean, seriously. A metal cage is actually pretty cheap. You just can't make that other cage cheaper. It's just hard. There's just too much going on in that cage. And to what end? That's the question. So why do I do this? So here's what I think is going on here. So San Diego Spine Institute, unfortunately, Paul here, our little friend over here, he's had some bad influence from some of his mentors here, And the doctors are highly specialized, deeply compassionate. Clearly, if it's new and bright and shiny, we're going to put it in you, okay? But here's what's wrong with this equation. If you take Paul and you give him an expandable cage, will he be as good as me? No. That's just the way it is. So I don't think an expandable cage is really going to help. I mean, static cages with modern materials lead to optimal fusion. Just look at this picture. Which one of these things looks like you've just shoved a bunch of metal into this space, right? Which one of these is going to fuse? And by the way, if you take static cages and use good technique, you combine it with the SPO or you combine it with some other decompression, I can get hyperlordosis from a T-lift cage if I do a PSO in the back. I can do a lateral in the front and put a hyperlordic static cage and get good alignment correction. So why mix the two? So here's a shampoo I use on the left. This is what I use because, how many guys use the 2-in-1? Any guys use the 2-in-1? Because I'm lazy, right? My wife wouldn't touch that. That's the shampoo my wife uses. It's expensive. Mine is not. And it's got two different parts, shampoo and conditioner. I mean, how many of you guys use the shampoo and conditioner in the hotel here? I use the shampoo. I did not use the conditioner because I'm not that kind of guy. Why? Because I'm kind of lazy. But the problem is there's a reason they separate these things together. Fusion and alignment are separate things. You shouldn't try to combine the two because this is what you end up looking like, okay? I want to look like the person on the right. Well, no, that's not going to happen. I want to, no, don't want to make jokes. They'll get me in trouble. All right, the left side, though. Exactly. This is what's actually going on. So in the end, this is what I'm saying. Expandable cages are weapons of mass delusion in spine surgery, and they make you think you're a better surgeon, but you're not. You want to be a better surgeon, not a better mousetrap. Thank you very much.